We talked in part 2 of this video series on pharmacokinetics and about the concept of absorption. Simply put, absorption is the movement of the drug into the bloodstream from the site of administration, whether it be oral, IV, subcutaneous, nasal, or whatever it may be. It answers the question of how it goes from the pre-consumption form of the drug into our bloodstream for later potential effect on the human or possible detection in blood if sampled. When dealing with DUID cases, it's essential to know a particularly important part of absorption called bioavailability. Broadly defined, bioavailability is used to describe the fraction of an administered dose of unchanged drug that reaches systemic circulation. If the drug was administered by mouth, the fraction that got into the bloodstream could be determined by comparing the same dosage amount given directly into the blood, meaning by way of IV. By definition, drugs that are administered by way of IV delivery have a bioavailability of 100%. What becomes trickier are those drugs that are not administered by IV, but another route of administration. For example, chemicals taken by routes other than IV route, the extent of the absorption and the bioavailability must be understood in order to determine whether a certain exposure dose will induce impairing or even toxic effects or really no effect whatsoever. The concept of bioavailability may in part also explain why the same dose may cause toxicity by one route, meaning IV for example, but not another route, meaning smoking. Different examples exist of drugs and their different bioavailability. For example, oxycodone has a bioavailability of about 60.7% or thereabouts when administered orally. Rectally, the administration is reported to be about the same, but when administered by intranasal means, varies between individuals with a mean of about 46%. Other drugs that are taken a look at in terms of their bioavailability include morphine. Morphine, when taken orally, has a bioavailability of about 30%. And that's because 70% of the drug is metabolized via first-pass effect, meaning metabolism by the liver. So that's why morphine is therefore usually given via intramuscular injection to bypass this mechanism and this breakdown that occurs. Codeine, on the other hand, has a bioavailability of about 90% when administered orally. Cocaine has a bioavailability of about 33% when taken orally, yet when administered by intranasal means is about 60 or 80%, and when given by nasal spray, about significantly different. There are many factors that affect the bioavailability of orally administered drugs. This includes, but are not limited to, the rate of dissolution, meaning breakdown of the drug in terms of formulation, whether it's a liquid, solid, or whatever it may be, surface area of the drug, and the formulation, meaning the microparticle size has the greatest surface area. For example, pH in the gastrointestinal tract is another thing that can affect it. And fat, or the lipid solubility, the more lipid soluble, the greater it is absorbed. And concentration administered. Smaller doses tend to be more bioavailable than larger doses. Food and drugs compete with in the GI tract for absorption. The more food present, the slower the absorption.